Hello, everyone. My name is Erin Hager, and I am faculty at the University of Maryland School of Medicine, and I chair the Maryland State School Health Council. And I'm going to be talking today about community involvement as it relates to child mental health in general and during the pandemic. And so we know that community involvement leads to a broader array of mental health services and supports that might be available to children in schools. And a huge part of the WSCC model has to do with community. It surrounds the model, it's embedded in the model, and we talk about it a lot. And we've definitely learned in the pandemic that community partners have really been willing to get involved, have been active partners in a lot of different efforts in schools. And so we would hope that when we start talking about how we can address mental health needs of students, again, in general and during the pandemic, that our community partners would be right there with us side by side so that we can really support our students in helping them with what they need. So some example actions in general might be to invite community partners to participate on a school mental health task force or different awareness campaigns just to increase the, again, awareness that mental health concerns are a part of life for many, many, many children and adults. And that these are things that we can work together to address in schools. Another thing that could be done for schools in general would be to develop an MOU with community mental health providers to increase the access for students to the different types of services and supports that might be available in the community. And so I know a lot of different LEAs have community partners that work in the mental health field that have been vetted by the school system. And so for schools to kind of find out who those partners are, how they can access those resources for their students would be a really important aspect as well. And keep in mind throughout this entire webinar today, we're not just talking about students who have are experiencing a serious mental health crisis or students who have symptoms of depression or anxiety, but maybe it's students who who've just seen a bit of a change in their current mental health state and are at a higher risk for heading down a road of depression. And so whatever we can do to prevent a mental health crisis, but also address it in schools, is really essential, and community members and community partners are really a big part of that for many LEAs. And so as far as suggested actions go for the response to the pandemic, it could be that schools work with the community to develop a directory of available mental health supports for students and families in schools and in the communities. Sometimes when a parent needs a resource for their child, they just don't know where to go. And clearly schools are a trusted partner. And so if there is a list, a directory of sorts of different resources that are available, that could be a great support for families. There could be a town hall or a resource fair that's hosted by the school, either in person or virtual, where different available mental health resources and supports could be promoted. This would clearly provide resources for families, but also normalize that this is a big part of life for a lot of individuals. Again, like we said before, consider establishing MOUs with community practitioners to expand those availability of services and supports. Again, now more than ever, this could be really essential as we respond to the pandemic. And then finally, strategizing with community partners, the different ways to increase mental health services and supports to students who may need them right away. I know a lot of mental health providers are experiencing huge volumes of patients right now. And so ensuring that our students in our schools also have access to these providers in different formats, whether it be in person, hybrid, or virtual, could be really essential as we return from the pandemic. And so that is our vignette specifically focusing on community involvement. And again, community partners are such a key part of all of our school health efforts that including them in this effort as well is really, really essential. So thank you for listening.